Okay. So, hello, my name is India Stevenson, and I'm a current junior at the college. I'm double majoring in biology and human health, and I am currently the community outreach chair on the exec board of Bridging Medicine at Emory. And today I am interviewing Dr. Randhawa, who's an infectious disease biologist at the Fred Hutchinson Cancer Research Center. And today we'll talk to her a little bit about the work that she does and also the work that she's been doing within this pandemic. And so, Dr. Randhawa, can you tell us a little bit about you and the work that you focus on?
Sure. Thanks, India, for speaking with me today. So I'm originally from Canada. I was born in BC, but mostly grew up in the province of Alberta. And I did my undergraduate studies at the University of Oklahoma, where I got a bachelor's of science in microbiology before moving back to Canada for grad school. I attended the University of British Columbia to get my PhD in experimental medicine, and my research focused on how the host pathogen interactions with Mycobacterium tuberculosis, which is the bacteria that causes TB. I continued to study TB when I came to Seattle to do a postdoctoral fellowship at the University of Washington, and there I studied the role of host genetics in mycobacterial diseases such as TB and leprosy. So after that, I worked in the biotech field for a couple of years before returning to academic medicine. And as you mentioned, I'm currently a faculty member at Fred Hutch in Seattle in the Vaccine and Infectious Disease Division. I'm part of a large consortium of international researchers that are studying HIV prevention. And most of my work is focused on evaluating vaccine candidates for HIV as part of the HIV Vaccine Trials Network.
Okay, thank you. Um, I guess for the next question, can you tell us a little bit more about the current HIV prevention work that you're doing or where we are currently with HIV prevention?
Sure. We've made a lot of progress in the past few years for HIV prevention, but we still don't have a preventative vaccine, and HIV really remains an important global health issue. So you're probably familiar with PrEP, which is an oral drug that people can take to prevent HIV, and that's made a lot of difference in certain communities. And there's a recent study that was completed looking at a long-acting injectable form of that drug, and those results look really great. And so I think once that's available, that's going to make even more of a positive impact because people wouldn't have to worry about taking a pill every day, and they can come in for an injection, every few months or something. So that's definitely helped us along and is still kind of biding us time because we really still need a vaccine. That's, as Tony Fauci always says, the vaccine will be the final nail in the coffin for HIV. So the vaccine work has been really challenging. This is something that people have been working on for almost 30 years. And we had a bit of a setback at the beginning of the year where one of our trials, we learned it wasn't effective. But we also have some great candidates in development. And one of those is in phase 3 efficacy trials, and it's a collaboration with Janssen Pharmaceuticals. And that study, I think we'll know, in a year or two how that's working. So we're optimistic about that approach. And we also have a lot of different vaccine candidates that are kind of in early development. And we're trying to also take different approaches, like looking at how to kind of mimic the protective immune responses that happen in natural infection by trying to induce the body to make antibodies that can neutralize the virus. We call those broadly neutralizing antibodies. So that approach is looking very promising in early phase studies, but it's going to be a few years before we can actually look at an efficacy trial. But along the same lines, we took a different approach. Instead of like a vaccine to induce the immune response, your immune response to produce these broadly neutralizing antibodies, we tried just infusing participants with the antibody, a monoclonal antibody, and that is it's kind of a proof of concept trial to see if that would work before we could determine if it would be effectively implemented. And that study is called the AMP studies, and we actually just have kind of our internal unblinding of that of those results, but the results will be released more publicly in a month or so. So I think you'll be hearing more about that study in the news. And that approach is something that is being considered for many other types of infections as well.
Okay, thank you. So you gave some insight into the kind of vaccine trials and the different projects that are going on with HIV prevention. And my next question relates to how you determine the desired participants for these projects and your trials, like the volunteers.
Yeah, it's a great question. Really we want to focus on populations that are most at risk and vulnerable. And for HIV, that kind of depends on where you are. So in the Americas, for example, in North America, Central and South America, we focus a lot on men who have sex with men and transgender women, and in some studies even on people who inject drugs. And in the U.S., we know that Black people are more disproportionately impacted by HIV. So, we really work closely with communities. We have an entire group of community engagement scientists who are working closely with communities to enroll folks who are most at risk. A lot of our work is in Southern Africa, where it's a different population that's most vulnerable to HIV, women and sex workers. So the population is slightly different.
The next question relates to challenges and barriers in research. And specifically, I wanted to ask about the challenges that you have faced in research pre-pandemic, because I know the pandemic would present a different set of challenges as well.
Yeah, it does. Let's see. So, along with there's a lot of challenges working with HIV in general. Obviously, that's why after 30 years, we don't have a vaccine. So that's definitely at the forefront of my mind all the time. The virus mutates very quickly, and there's many different circulating strains. So it's been difficult to kind of use traditional approaches for vaccination. And also natural infection with HIV doesn't result in immunity, so we can't really take that approach of just trying to mimic a protective immune response, because we don't fully, we don't really see that. But I think the biggest issues, the biggest challenges and obstacles are more around the social determinants of health. And we can think all about, who's most at risk, whether it's due to behavioral risk or due to genetics. But until we actually address the social determinants, we'll never really be able to make progress. Just like with PrEP, we know PrEP works, but not everyone has access to it. It's not, it can be expensive. So we really need to focus more on that. And while funding for this type of research really has been focused on different biomedical approaches and research strategies in laboratories, we don't really have as much investment in overcoming those social determinants. And so we are trying to do what we can. As I mentioned, we have a huge community engagement group and effort, and in trying to help break down some of those barriers, but a lot of those still remain. So, we really need local governments and federal governments and all the places that we work to invest in kind of, breaking down some of those barriers so that we can actually implement these biomedical prevention strategies more effectively.
What are some additional challenges that the pandemic presented to your work? And did it shift the focus of your work? Did you have to adjust anything in your projects?
Yeah, it did. It at first, so kind of thinking back to March, which seems like so long ago, but still also kind of just seems like it was only yesterday. Um, for our HIV studies, immediately we had to think about the safety of our study participants and our clinic staff. So most of the studies were at least put temporarily on hold. We couldn't be, asking participants to risk their health to come into the clinic. A lot of the clinic investigators, the clinicians, and others had to shift their own focus to addressing this new pandemic. And so we had to evaluate every study and think about what we could do to put things on a pause and how long we should do that for. And then we also had to kind of evaluate our priorities. Obviously, this type of situation puts everything in perspective, and we had to think about what are the trials that are most important to move on, what is the work we should really be prioritizing, and so that when things did start opening up again in some communities, we would only focus on the studies that we think could have the biggest impact. So once different communities started opening up again a bit more, we had to shift our thinking to some of the operational challenges that could happen that we needed to address, like how are participants going to get to the study sites? Can we help them, find safe options for transportation? Once they are coming in for their clinic visits, how can we make sure that they and the clinicians are safe? So what PPE do they need? The workflows and just logistics that had to change to make sure that they could either stay distanced or have the appropriate PPE. A lot of different operational challenges. And so a lot of those are being addressed from our kind of clinic side, and on the research and kind of vaccine evaluation side, our group, a lot of us had to shift to COVID work as well. So in March, I started working with the University of Washington. The virology lab there was one of the first to develop a test for COVID, and Alex Greninger and Keith Jerome, who run that lab, kind of were some of the pioneers in getting the testing up and running and scaled up, and they were able to do that pretty quickly. But then, of course, they had a ton of data, and while they're focusing on ensuring they can handle the capacity, we stepped in to help a bit with looking at the data and understanding what was happening with comparing different types of tests that they're doing. So I've been working a lot on that. We've had some community surveillance studies, both here in Seattle, but also in other states that I've been working on just to evaluate like what the prevalence may be in those communities. And we also, the biggest thing that's happened, the biggest change is that the same group of researchers who are part of the HIV vaccine trials and the HIV prevention network formed a coronavirus prevention network. So for really to kind of hit the ground running and start really evaluating what's happening with this pandemic and starting to work on some of those vaccines. So we have a few studies that are already ongoing, and we're partnering with the major drug companies that are making these vaccines and also the US government to ensure that these trials are conducted ethically in the right populations, in making sure there's equitable representation of different populations, but also in what I've been more focused on is ensuring that we can compare the results of these trials and really understand how the kind of prevention efficacy. And so that's kind of what's taking up most of my time these days and where most of my efforts have been focused.
Thank you. That sounds like a lot to be working on. And I know as a student, one of my challenges through all of this has been staying motivated and staying in like the school mindset on top of everything. So, what's a way that you stay motivated and engaged with the work that you've been doing?
Yeah, that is That's a difficult one because I mean I think overall my motivation has always been the desire to reduce death and suffering due to infectious disease, but especially amongst the most vulnerable. So that motivation is always there, and I think that's something that um, is always going to be there. But it's more about just trying to stay focused on that and focus on what I can do towards that goal, despite all of the chaos around us right now and all of the the news that can be kind of very depressing at times. And so what I do to stay engaged is I need to focus on my mental health. I try to make sure I'm taking care of myself and my family and friends. And um, it's also about just, prioritizing the work that I think will actually have a more immediate impact. Um, so yeah, it's difficult sometimes to do that in this, working with all of this in this environment, really. Um, but it keeps me motivated to think about the mission, to think about the people who are being most impacted, and also my colleagues keep me motivated because it's a great group of people who kind of share a common goal. So I find some inspiration in them as well.
So you mentioned your colleagues as one of your motivators. Um, well, a lot of our members in the club are looking towards future careers in research, medicine, public health, various different fields. And I know that public health is a field where that's very interdisciplinary, where there are very different career paths and different, um, I guess, different fields that combine together to work towards these different issues. So, what advice can you give someone who is interested in entering the field of public health or entering the field of research in general? Do you have
Mhm.
any advice for like aspiring researchers?
Yeah, I think finding what motivates you is really important, because even if you think there's a certain path that is going to be easy to find a job in or pays well, it's still going to be a lot of work and effort. And I find that if you're motivated by it, it's much easier. It feels less like work as well. That's kind of when it's the best situation where you're doing what you love as your career. So finding what motivates you is really, really important. Um, so as far as getting involved in research, I highly recommend doing that as soon as possible because getting just a taste of the different types of research, whether you're in a laboratory working at the bench or doing more computational or epidemiological work at a computer, getting involved will help you understand what parts of it you like, what you're good at, and what is going to motivate you. So I know right now it can be difficult as there's not a lot of laboratories are inviting research assistants, but there are other ways that you can still get involved by attending department seminars. There's so many great seminars that are actually more accessible now in the time of COVID because of Zoom or web meetings. So like the American Public Health Association has done a tremendous job doing all these seminars and making them very accessible to people so you can not only keep up with the research and find out about what's going on with this pandemic without all of the influence and opinion of the news stories, but you can learn about the different research methodologies that are being used and maybe find some inspiration in what topics interest you, but also find out who are some of those important investigators who are doing this work that you might be able to reach out to get involved. So attending those department seminars, looking at, if you're interested in graduate schools, even looking at their department seminars and starting to understand who the researchers are and what they're doing, I think is kind of something that I wish I did more as an undergrad and wish I had more opportunities to do. So that's definitely something I would suggest doing.
Thank you so much for talking with me today and sharing the inspiring work that you do. I really appreciate your time and I hope you have a great rest of your evening.
Thank you, India.